Our stigma, misconception and high cost of treatment remain the leading challenges caregivers and patients of sickle cell disease in Kenya face. As the world marked Sickle Cell Disease Day today, researchers and experts still warn that there is a gap in awareness about the disease, even as it emerges that Kenya has no clear data collection mechanisms on the disease, thus hampering the fight against it. NTV's Macharia Mbogwa shares a story of a mother burdened by the disease, having lost one child to it and nursing 3 others.
At Kapchumba Estate in the outskirts of Eldoret, we catch up with Nancy Juma going on with her domestic chores. Her 2 children are at school. As we settle down, Nancy narrates her ordeal with the genetic disease, which she says she knew about it but never imagined it would directly affect her.
Akaanza kugonjeka. Mtoto analia kila wakati, usiku mchana. Sisi tulikaa tukassume ni ile tumbo ya mtoto akishazaliwa anaumwa na tumbo. Tukamnunulia dawa tofauti, but there was no change.
Nancy then took her child to hospital and a sickle cell test turned negative. This gave her hope. However, the medics would later realize that the test was done after the child had undergone blood transfusion, hence the need for a second test that turned positive.
Tukakuwa cancelled, tukaambiwa sickle cell ni nini. Tukakaa tu na mtoto, but yeye naye alikuwa anaumia sana, on off.
In 2017, Nancy lost her firstborn daughter who was aged 6.
Nikaona hapa kuna kitu yenye si ya kawaida. Nikamwambia amka, amuki. Kumbe asubuhi mtoto alipata stroke kwa kitanda. Hatujui anything. Akamwona. Akaniambia, "We, this is serious. Mpeleke MTRH." Kumfikisha huko, kalazwa 3 days na akapasa.
Painful as it could be, her lastborn was also later diagnosed with the disease.
My secondborn amekuwa admitted 3 times since azaliwe. Ako 9 years. But huyu mwingine mdogo amekuwa admitted multiple times.
Liz Owino, in her late 30s, a psychological counselor, is a sickle cell warrior, having been diagnosed at only 6 months old. Out of a family of 5 siblings, one of her brothers was also diagnosed with it. In her work as a research assistant, Liz says the biggest challenge growing up with the disease remains to be stigma.
Before I accepted myself, I used to face a lot of stigma, and I could blame myself for being a burden to my family. But once I accepted myself and then also have a very supportive family, it felt so good. That support gave me hope.
As Kenya joined the world in marking Sickle Cell Disease Day, in Eldoret, stakeholders engaged in cycling event as a campaign to raise awareness about the disease. The climax of the event was a blood donation drive.
We started with a bike train whereby we cycled for about 7 kilometers. All this is just to raise awareness for the need for sickle cell care and for the need for blood.
Experts, however, warn that Kenya does not have accurate statistics on prevalence of the disease in the country, even as it emerges that Africa has over 70% of the global patients.
Globally, there are over 7.7 million cases of sickle cell disease. More than 70% of this are in sub-Saharan Africa. Annually, we have over 350,000 births. More than 70% of this are in sub-Saharan Africa. But the Ministry of Health have estimates where we estimate that about 14,000 babies in Kenya are born with sickle cell disease.
If we can adopt a policy where all newborn babies are able to undergo mandatory screening, this would be very important, because at the end of the day, you'll be able to get these patients early, you can initiate treatment early, you can prevent some of the complications that we see them when they come late in the hospital.
Further, concerns have been raised on the cost of medication and management of the disease, even as the need to enhance sensitization programs to the public about sickle cell.
Focus on availability and accessibility of the already tested and proved modalities of care for warriors. So it's very unfortunate if our insurance covers then are not able to help them when it comes to care in terms of pharmacy, in terms of laboratory, in terms of clinical acquisition.
Can also urge the government to put more funding in curative therapy, not now management. Curative like genetic editing and stem cell transplant, they're really changing the lives of sickle cell warriors.
We need to go to the community, we need to talk to them, we need to make them understand that it's a genetic thing and the patient does not choose to have the sickle cell disease.
Even as the world marks Sickle Cell Disease Day, it is the hope of Liz and Nancy that going forward as a country, we should be able to adopt curative options rather than just management of sickle cell disease. Mashari Mbogwa, NTV, Eldoret.